So now we're going to test for hip flexion. The test for hip flexion, you want to make sure that the patient is in supine, the pelvis is in neutral, the knees are fully extended, and the hip is in 0 degrees of abduction, adduction, and rotation. To feel that the pelvis is in neutral, you want to palpate the ASIS and the PSIS and make sure that they are vertically in line with one another. So right here. So Katie is good. And then to make sure that the hip is in 0 degrees of rotation, you want to palpate the lateral epicondyle and the medial epicondyle of the femur and make sure that the patella is facing anterior. Okay, so that's good as well. We are also going to look for the gradotrochanter, which is the landmark for the fulcrum of the goni. So to do that, I'm going to passively, internally and externally rotate her femur. And you can see that the gradotrochanter pops out when you do that. So that is going to be the landmark. Okay. So for stabilization, you're going to stabilize the ipsilateral pelvis. So if we are testing the right leg or the right hip, we are going to have our hands on the ipsilateral ASIS and PSIS. And then we're also going to watch the contralateral lower extremity to make sure that it stays flat on the table. So the testing motion is we're going to stabilize the ipsilateral hip or the ipsilateral pelvis, and we're going to flex the hip and also passively flex the knee. And right there, the end feel is going to be soft because of the muscles, and then you can see that the pelvis is, or you can feel that the pelvis is posteriorly tilting. So that is going to be the end of the range of motion. So you take the goni, and the fulcrum is going to be at the greater trochanter, and the proximal arm is going to be lateral with the pelvis, and the distal arm is going to be on the lateral midline of the femur, and you're going to use the lateral epicondyle as a landmark. So Katie is at 122, so she's within normal range.